Hi, everybody. Welcome to BeTime. I'm Beth Bierbauer, healthcare executive, author, and host of the BeTime podcast. BeTime is a podcast for individuals who want to invest in themselves and their careers through continuous learning. And each week on BeTime, I have the privilege of interviewing a seasoned executive, a company founder, or other industry expert, and we talk about a lot of different business issues. You'll hear about people's professional journeys. We talk about career advice and business insights, emerging trends, and more. So whether you're with a large company or a small business, whether you're inside the industry or out, BeTime has something for you to help you stay on top of your game. So let's get started. The Affordable Care Act took effect back in January of 2014. And during that time, there was a New York City startup that entered the fray by offering individual products on the federal health insurance marketplace. Now, this startup was unusual for several reasons. First of all, its name, Oscar Health, was unusual. In addition, its three co-founders did not have any healthcare or insurance industry experience. Their plan design was a bit unique as well. They certainly offered the high deductible health plan, which many of us are familiar with, but they provided 100% coverage for telemedicine visits prior to meeting the deductible. Now, many industry experts were really skeptical about a startup entering the fray during such a volatile time in our nation's healthcare coverage journey. But here we are, over 6 years later, and the team at Oscar Health have seemed to have quieted their critics. Many large insurers exited the marketplace very quickly, but Oscar Health hung in there. And they have now expanded well beyond New York City and are available in 18 different states. In addition, they've also expanded their product lines to small business as well as Medicare Advantage. And I'm really glad today to have co-founder and CEO Mario Schlosser with us to tell us where they are in their vision to fix a broken healthcare system and improve outcomes, and also give us a little bit of history about the startup and what their rationale was. So please join me in welcoming Mario Schlosser to the BeTime podcast. Mario, welcome to BeTime.
Great to be here, Beth.
Well, we are glad to have you. So Mario, why don't you explain to our listeners why you decided to do an insurance startup? You don't have a healthcare or an insurance background.
Yeah. First of all, when Oscar started in 2012, the whole category of insurtech didn't really exist at all. I was looking at Google Trends the other day, and I think that terminology first got coined in maybe 2014, 15 or so, when we were already, off to the races. So fairly early on in the history of sort of like rethinking insurance from a technology perspective when we started. And for me, the motivation was that my wife and I were going through our first pregnancy back in 2012 with our son Noah, who's now next door here. Doing remote math homework, and I just helped them with fractions, if you care to know. And in that pregnancy, I realized that the U.S. healthcare system is uniquely complicated and uniquely costly. And both of these together, they probably kind of play off each other, right? The costs has a lot to do with the complexity and vice versa. I'm from Germany originally. I'm a computer scientist by training, and I thought I could figure out how bills work in the US healthcare system. I really couldn't. And we thought that the insurance company is a really important missing link in making healthcare more affordable and more navigatable for end users of healthcare. And so we kind of built Oscar, frankly, for helping ourselves in navigating healthcare. And then we thought we've got a unique model here. We want to bring this to as many people as possible in the US and scale Oscar up.
Well, speaking of people, can you share with our listeners how many members you cover now, what states you're in, and the products you're offering?
We've got 529,000 members as of end of January this year in 18 states, in 3 product lines: individual, ACA, small employer plans. These are employers under typically 100 employees, 50 employees in some cases, and finally Medicare Advantage.
Okay, that's quite impressive growth. Let's dig into your concept a little bit more. You have 3 legs of the stool. Data is critical, technology, and then the care team. Why are these pieces critical to creating a new business operating model within healthcare?
Yeah, so if we start with what the insurance company does uniquely well in US healthcare, I would say it's 2 things. One is it has a lot of data visibility. It sees all claims running through the system. It's, it knows which doctors you visited. It can look at clinical records that you produce as you navigate healthcare. And so it's got the best end-to-end longitudinal view of healthcare. There is no other entity in US healthcare that's got as much visibility as the insurance company. I'll give you one interesting data point there. When we look at our vaccination data, so all data we have on which vaccinations you've had, whether it's now COVID or previously yellow fever when you go traveling or something like that, only about a quarter of that data even comes from our own claims data. 3/4 come from states, vaccine registries, from EHRs, from other sources that we can tap into because we're the insurance company. And so that gives us a very unique visibility into your data as you navigate healthcare that nobody else has in this particular way. The other superpower, if you will, of the insurance company is its power to set incentives. It can determine what members get reimbursed when they navigate healthcare, and it can determine what it pays providers, physicians, hospitals, labs, and so on. And so those are two pretty formidable powers in the US healthcare system to shape how the system works. But the missing pieces, we thought, to really make use of those powers are that insurers sit on very outdated technology infrastructures. Many insurance companies in the US grew by acquisition. And so, they would have 20 different claim systems underlying their overall infrastructure. They've got real data centers, they're not in the cloud oftentimes. And that holds them back in many places, in many ways. And the second thing is insurers often lack member engagements. If you are insured by your employer, which is the case for, I think, about 150 million people in the US, then it's actually not even your insurance company holding the risk for your outcomes. It's the employer holding the risk. The insurer is just sort of like a back office claims operator, provider, whatever else, not even provider, but sort of like, manipulator, if you will. And it doesn't occur to you as an end user of healthcare that the insurance company is a place to go to for advice and for looking at which physician is good or not good, and so on. And so at Oscar, we thought we got to fill those gaps. We got to be particularly good at technology. That addresses you as kind of second category, right? Technology. To take the data that you generate when you navigate healthcare, to engage you in a very unique way and essentially get you to the right place at the right time as you navigate healthcare. So that's the core concept of Oscar. Very high member engagements, built in a modern technology stack to get you to the right place at the right time.
Well, you're absolutely right that the insurer really has the opportunity to have the broadest view of the ecosystem. And by the very nature that they are the payer, has the ability to even get additional data and to get the right data.
Yeah.
But you're also right that they traditionally have not done a good job in the past in engaging members. Most people don't wake up in the morning and say, how can I engage with my health plan today? Right?
Yeah, exactly right. Yeah.
They may think about their doctor, but they're always looking for value, and they may engage with another type of provider because they're looking for value.
Exactly. There's a lot of things you would typically go to before you go to your insurance company, whether it's Googling the doctor or, talking to an existing physician or to your friends, frankly. And so in Oscar's case, that's very different. We have about 47% of members coming back to us on a monthly basis, at least, meaning at least on a monthly basis, people log into the mobile app and look at physicians, or they talk to the Oscar concierge team, a unique way of in the way we do customer service. And they use us to navigate the healthcare system. In about 43% of all first-time physician visits under Oscar, meaning you go and you need a new cardiologist or a new primary care physician or something like that. In about 43% of those cases, members use Oscar to find that physician. And so that gives us a much, much higher ability of making sure you get to the right place at the right time. You don't fall through the cracks in any particular way. We can follow up on your healthcare issues and needs with you proactively and make sure you save money at the end and get better quality outcomes.
So Mario, you're offering 3 different product lines that on the surface look very different, look very distinct: small group, individual, and Medicare Advantage. Are there more commonalities than what we're seeing on the surface?
Yeah, the biggest commonality is that these are all fairly individualized. So obviously individual ACA plans are literally individualized. You buy them directly, and you may have a broker in the middle there in the conversation, but you are still having a relationship directly with Oscar. So that's obviously the most pure form of individualization. Medicare Advantage, very similar. You make a decision to buy those, and again, you go and have the relationship and pay the bill to Oscar. And small employer is still pretty similar there as well. It's essentially the small employer business owner oftentimes making a decision, and these are groups on average of a size of 10 or so who buy coverage. And so it's still very an intimate relationship, if you will. So that's one commonality. The other commonality is these are all fully insured business lines, meaning Oscar has the full risk for your outcomes. And I think that's a very, very powerful feature of Oscar's. That's if we are able to save you money as somebody navigating healthcare, then it's good for you, obviously. Less out-of-pocket payments, lower premium, and so on. But it's also good for us as the insurance company at the same time for our business model to save money in healthcare. And so we're very uniquely aligned in making sure we've got the same incentives. And I don't think that's the case for the rest of the US healthcare system, where the vast majority of players in US healthcare tend to be in fee-for-service still. And that has sort of like a built-in incentive of really, if the costs go up, nobody really minds it. And that's one reason why you've had 4 or 5% healthcare cost inflation for the past couple of decades, as compared to obviously consumer price inflation of maybe 2% or something like that. And why healthcare has become a bigger and bigger part of the US economy, which is ultimately not necessarily productive investment in building cool stuff, I would say, in the way the economy should be incentivized to do. And so these 3 product lines are all in the end putting Oscar at risk for delivering outcomes, or the partners we work with at risk.
Now, from a Medicare Advantage perspective, was it the fact that it is a risk-bearing organization and it is selling directly to individuals? Were there any other factors that prompted you to get into the Medicare Advantage market?
Yeah, I'd say 2 more factors. One is that it's obviously a growth market in US healthcare, meaning you have every day, I believe, 10,000 members aging out into Medicare. Of those, probably about half of them by now are choosing to be in Medicare Advantage and buy from health plans directly. So that makes it a very big growth market. Perhaps the biggest current growth markets. We can talk about individual in a second there, how I think about growth there. The other important driver for us in MA is that members are, quite high utilizers of healthcare. And if there's one thing we've consistently seen in Oscar, it's that the more people utilize healthcare, the more they like Oscar, the more they see a need in Oscar. And so we have generally the highest in promoter scores, the highest utilization, the highest engagement with Oscar among those folks who are more chronically ill, have more healthcare needs. And that's certainly the case for those over 65 years old.
For sure. Having that navigational assistance at that age when you're no longer part of an employer group is really, really critical.
It's the best application of everything we've been building for Oscar, and in all kinds of ways, and certainly from an engagement point of view.
So besides expansion and growth, what is it that keeps you up at night from a healthcare perspective? Is it we're not going fast enough into value-based care? Is it rising specialty drug costs? What is it that keeps you up at night?
Yeah, I would say I kind of see 3 things driving the evolution of healthcare, and I think all 3 have gotten accelerated by the pandemic. One is shift towards consumerization, right? Everybody is used to better member experiences that are more seamless and more end-to-end in the rest of their lives, and it's not the case in healthcare yet for the most part. So there is a probably more like a marathon rather than a sprint towards who really owns the end user in healthcare. And so helping define that, I think, is really one important part of what Oscar is doing. So consumerization, one big trend. The second big trend is obviously towards digitization, virtualization, right? Virtual care in the pandemic has shot through the roof. Oscar, I think, was ahead of the curve there in many ways. We had even before the pandemic, 1 out of 5 visits of any Oscar member was already virtual, and many of those went through the Oscar medical group, our virtual physician group that we run ourselves, or there's a captive physician group that's owned by Oscar. And we've been but we've been moving since then even more towards risk-bearing virtual primary care and so on throughout the pandemic. And so pushing the envelope there in virtualization, pushing more into the home, pushing more out of the hospital and so on. That's the second big trend. And the third big one is, as you said, the shift towards the shifting of risk into the front lines, meaning shift towards value-based care, providers taking more and more risk, and so on. And I think these are all very connected. I don't think you can shift the healthcare system more towards virtual unless you also shift it towards risk. Otherwise, we'll have endless fights between providers, payers, the governments, end users about how should you reimburse virtual visits. If you're a provider and you remain fee for service and your visits go towards virtual, and we want to use virtual towards bending the cost curve, providers will make less money. It's just unfortunately the case, unless they can also shift towards taking more risk for the outcomes, in which case shifting towards virtual is a great thing for them because it's less costly to run a virtual visit than to run a visit in person, staffing a practice team and so on. So these really go hand in hand. But everyone's sort of like from all the different parts of healthcare converging on that same center. And the center is who owns the risk, who owns the end users sort of like attention, and who does the end user start his or her navigation with in healthcare. And so that's really going to be the important center I think everybody's going to try to define. For me, it really is sort of like a tale of two cities there. One is a question of two pathways for us. One is how much of this can we do ourselves, and where do we best occupy and drive towards that center? And the second thing is, who are the best partners for us to do this with? Oscar, on the one hand, has an insurance business, and we talked about the three business lines we have there. On the other hand, we actually have a platform business where we work with health systems, we work with existing insurance companies to build a better risk-bearing virtual end-to-end consumer experience that we deploy with somebody else. And so in that convergence towards that center, we do this ourselves to some degree, and we work with others in that. And the mix of both of these is one thing that's on my mind quite a bit.
Well, certainly one of the biggest challenges that carriers have today is that they are operating off of legacy systems. Makes it very difficult to access the data, to pull that data in so that you can actually leverage it to gain some insights. Now, you're very focused on consumers. So I'd like your opinion on both interoperability and transparency. The idea that I can actually carry my data with me, and the idea now that I can actually ask upfront, what's it going to cost me? Good thing for consumers?
100%. I think that's only good. Well, put it this way, it should be only good. Okay. I think the healthcare system is a incredibly interesting, complex tale of unintended consequences. I would say. Let me give a tiny example for that is sort of like a little bit in the weeds, but I think very elucidative of how healthcare works. Risk adjustments is a very clever mechanic that exists in Medicare Advantage and in individual ACA plans, where insurance companies and anybody who takes risk in the healthcare system gets paid more, either by other insurance companies or by the governments, the sicker the members are that the insurance company manages, right? You're obviously very familiar with that from Medicare Advantage. I'm very familiar with this from ACA individual, but also from Medicare Advantage. And in theory, and I think quite much in practice, it's a very clever system, right? Very intricate, gets updated a lot and so on. And the computer scientist in me is impressed by how well that was thought through. In practice, I think it's led to, over the past 10 years, and for the majority of the road of Medicare Advantage, I think a sprint towards better coding, not necessarily better management of healthcare risk. So if you look at how many practices and even insurance companies, Medicare Advantage, have made their money, is not so much by really managing down healthcare costs. It's a lot by making sure that sort of like, codes get better captured. If there is a diabetic who switches from Medicare fee-for-service, government run, into Medicare Advantage, immediately what happens is the cost go up as opposed to down, because the government now is going to pay more money for the diabetic if he or she's identified as diabetic by the insurance company or by the provider group managing the diabetic. And the savings only come maybe over a couple of years as the member gets potentially better managed, which is less clear that's happening right now in the healthcare system. And so I think interoperability is generally a great thing. I think transparency is generally a great thing. It should put pressure on the supply chain of healthcare, meaning the providers, the doctors, the hospitals, the lab providers, and so on, to compete on value, compete on giving you more for your dollars. In practice, given what I just told about risk adjustments, I kind of wonder if the immediate next couple of years will be more defined by the existing players finding clever ways to use the data to their advantage that now exists and didn't exist before. And I've had more than one health system say to us, oh, once it's clear, which insurance company pays us, we will finally be able to see what other hospitals get paid, and we can finally see if somebody gets paid more, we can ask for more as well. And so I'm wondering if you're going to see a race towards a lower common price, or if you see a convergence towards a higher common price. I hope it's the former, not the latter.
Well, even if it's a race to a higher common price, hopefully with market transparency over time, that will vet itself out, right?
Yeah,
because
I would hope that's been the case. I mean, the healthcare system, I think, is defined by, it's sort of like pretends to be a free market, but it really isn't very much, right? You can't really quit your insurance company unless you're Medicare Advantage or an individual. In commercial, you can't quit your insurance company for the most part. It's not clear, necessarily how good your doctor is and how much value for money he or she derives necessarily. And so those are all the mechanisms for driving accountability, meaning you can quit your insurance company, for example, need to come in line with the mechanisms for sharing data and transparency. And I think, again, more transparency is an important step, is a necessary step, not a sufficient step. That's how I would put it.
Mario, a lot of our listeners work in large corporations, and they really do want to make a difference in healthcare. What one piece of advice would you offer to those individuals who maybe are frustrated because of the complexity that they operate in on a day-to-day basis?
Yeah, I would say, first of all, don't get despaired by it. So I think it is an unbelievably complex system. There's just no question about it. I told people from the very beginning that healthcare is not like, there's no single algorithm that solves healthcare. Google had the advantage of inventing PageRank, which was their core algorithm that's basically, sorted websites, right? That's literally what it does. The original paper that Larry and Sergey wrote in, I think, 1997 or 1996, something like that, right? You can download it. Like, it describes how the algorithm works, and that became Google. And you know what? 25 years later, it's still Google. That's it. That's the majority of Alphabet's business, is still charging for ads based on this one algorithm. Now, there's a ton of other innovation happened alongside, but it really is this one clever insights into how the internet works that paid the bills there for the past 25 years, or however long it is. That is not healthcare. There is no single algorithm that will solve healthcare. And so it's really a game of not even inches. I don't even know I'm coming from the metric system, what the lower unit there is. It's a game of like nanometers in healthcare. Every little efficiency improvements matters quite a bit. Every little change in the incentives matters quite a bit. So I think ripples through the system in a good way. So start small, I would really say. Oscar, in many ways, when we started early on, we spent all the early months on what's a good doctor look like, and how do you define quality of outcomes, and let's design our buttons differently, whatever else. And 8 years later, I think the biggest contributions we've made internally, frankly, have been about, okay, let's pay claims a little faster. Let's change the way our data ontologies work, and let's increase paperless billing, for example. Really sort of like the small pieces sometimes matter even more. But those are the underlying infrastructure for then to get more interesting, more interoperable, and to move faster, iterate more quickly, and so on. So you gotta find, I think, a way in which you can redefine the underlying infrastructure, maybe carve out a part of the market for yourself, carve out a part of the, find a new market you can go into and kind of rebuild something from the ground, as opposed to being tied down by all the old stuff that sits in there. That'll give you over time more maneuverability and more speeds to bring to markets. I'd say the second thing is that healthcare, I give this advice to actually startup founders oftentimes. Healthcare is not an industry where the best product wins. That sounds cynical, but I really think it's the case. If you look at who's been successful in it, and I don't mean to, by the way, in any way put into doubt the motivation of people in it. I think really the majority of people in healthcare really feel great about the contributions they're making, as they should. I mean, it's ultimately a system that is important in a society. But the way it's set up right now, it lends itself towards a better business coming from, for example, better enterprise sales, or defining a more oligopolistic sort of like market structure for yourself and so on. It doesn't come down oftentimes to the best member experience or the best, the sort of like, where can you save people the most money, unless you seek out those markets where that is the case. And so for Oscar, oftentimes we really have tried to be smart about this for the past 8 years. Really find those markets where you can make sure it's not just sort of like who's got the best enterprise sales team that defines your success, but where our infrastructure matters, our member experience matters, whether we can save you money matters, and so on. And so I'm hoping that more of US healthcare shifts into that direction, and I think that'll be good for innovation for startups in the space.
Mario, we like to ask our guests, what's your favorite book and what's your favorite podcast?
Great questions. My favorite book, I would say, right now. So I actually, fun story. I track all the books I read when I buy them, when I start reading them, when I finish reading them, how much of it I read.
You track them on a spreadsheet or through Goodreads?
On a spreadsheet, yeah, on a spreadsheet.
Oh, okay.
Yeah. And then actually you can look at it. I have a Goodreads profile as well that I think is public, where you can also track what I'm reading, and you actually see my my highlights. I'm not sure anybody. I mean, the highlights I highlight in books. That's the. I read everything in the Kindle now, and happened for the past 10 years, or whatever. And so you can see highlights there, which is, if you care to know what I like in books, then you can look at that. I spent the pandemic, fun story, reading the Bible cover to cover, because I grew up Catholic. Not that I am super religious, but it's a tradition, and it's nice to have that connection and everything. But it occurred to me I've never actually read more than, I'd say, 10 sentences consecutively in the Bible, so read cover to cover, which is a very interesting experience. Now about 1/3 of the Quran as well, and so that's an interesting. It's just a very fascinating intellectual endeavor. I think to sort of like see the traditions of society emerge in this. The most recent interesting book I read was a guy named Stephen Wolfram. It's called Adventures of a Computational Explorer, and Wolfram is a computer scientist originally, was a child prodigy. I think wrote theoretical physics papers when he was like 18 years old or something like that, and has an unbelievably interestingly broad view on anything pretty much. So he sort of like has a mathematical but also physics-based exploration of linguistics and games and almost everything else in society that he sort of explores in this book. And I thought that was really interesting. And I think that in healthcare generally, we can benefit more from outside perspectives, whether it's data scientists or game design or neuroscience, whatever, motivations and things like that. And so anyhow, that's an interesting book that is worth reading.
Podcasts? Any favorite podcasts?
I actually, I hate to tell you, Beth, but I have not listened to a podcast in a long time. I got to start listening to yours now, of course.
Yes, please.
I'm glad you're doing it, by the way. We've known each other for, how long is it now? 4 years, 5 years, I think, right? 5 years probably.
Easily, probably at least 5.
Yeah, exactly.
And probably 7 if you count that I stalked you earlier. So sure.
Oh, that's right. You were in the Oscar office before it really had an office, frankly, when it was still in my co-founder Josh's kind of venture capital funds. In the conference room there. You're right. It's fantastic. I'm in a weird way. I don't know when I would listen. That's always the problem. I always just kind of like read on my phone, but I need to start doing it. So
no problem.
What's your favorite?
Well, you can start with the Be Time podcast.
I would start with that. Exactly. Yeah, if you got recommendations, you got to let me know.
Oh, sure. We'll have a few I can send to you. So Mario, thanks so much for sharing your story and everything that Oscar is doing, especially to help those individuals in the marketplace that are really seeking and struggling to find coverage oftentimes. And small businesses, very similar, right? They're just trying to keep their business alive, and it really matters to be able to find that. And of course, a Medicare Advantage. And thank you for taking such good care of individuals. Really appreciate everything that you're doing, and hopefully we'll have you back in a year or so, see how more you've grown.
Definitely. Thanks, Beth. Great to see you again, and talk to you soon. I'll keep you posted.
All right, great. And
Thanks so much.
with that, for our audience, that's another episode of Be Time, and we will be back in a week. Thank you.